Hello learners, I'm Dr. Paul Mayoni and this is a video welcome for Counseling 5270, Family Therapy Theories and Methods. My name is pronounced Mayoni, in case you're interested. You can call me Dr. Paul, that's fine. And in this course, I really enjoy teaching this class. I've been teaching with Capella for approximately the last 12 years. I'm a core faculty. And I like teaching the systems classes because I am drawn toward theory, and I was first drawn to the family therapy field because I was very interested in the very different way that family therapists understand mental health and presenting problems in a very different way than mainstream mental health, which is more of an individual pathology perspective. So we're going to talk about a lot of different approaches to family therapy. And I think it's important to understand that medicine and models are not the same thing. We don't want to treat models of therapy like they're medicine. Models or theories about therapy are more metaphorical, and they are ideas that make sense to the individual originator of the model, but they're not necessarily a truth. And despite what most beginning therapists think, the model is not necessarily the engine that drives therapy. I would put much more emphasis on the quality of the client-therapist relationship than I would the model. However, saying that, starting out as a family therapist, I was very much immersed in the belief that the model of therapy was directly linked to the outcome of therapy. And after practicing for about 25 years, I don't see it that way anymore. So one thing to keep in mind is that models are theoretical. Models are more like metaphorical, and they're a set of ideas or a handful of assumptions that can be very helpful in guiding the therapeutic process, but they certainly don't control the process. The other thing that I think is really important to know is that there is a perspective in family therapy that looks at family therapy more as a modality. So for example, you know that there's individual therapy, there's group therapy, there's couples therapy, and then some people would say, then we have family therapy. And so the modality perspective is just that you're a therapist sitting with a different group of people, and in this case it's a family. And that is a very limiting perspective of family therapy. The tradition of family therapy that we espouse in this program is much more rooted to the family therapy field and the pioneering vision of the early family therapists that looked at family therapy is a different understanding or a different epistemology, if you will, of how we understand human problems, clinical problems, and in general mental health phenomena. And that shift in epistemology goes from thinking that individuals are pathological in some sense, to viewing relationships and symptoms in context. And if you look at any symptom in context, it starts to make sense, and it becomes less pathological. In fact, pathology can fall away when you begin to look at a symptom in context. And the context that we generally tend to look at symptoms in is relationship context, family dynamics, couples relationship, etc. So this idea from thinking in a more individual pathology way, which our culture is steeped in, to thinking more systemically. Not systematically, sometimes those words are confused, but we're talking about thinking more systemically or relationally. And that is seeing people in context. And we'll have much more to say about that. But this idea of viewing people in contexts leads to another very important fundamental family therapy idea, which is that there are problems within individuals or within families that we could call them deficit-based approaches to therapy. A deficit model or a deficit-based approach is one that views people in some sort of pathological way. So in saying that somebody's got an anxiety disorder or somebody is depressed, those are pathologizing labels. Or to talk about a family as dysfunctional, or people having communication problems. These are all deficit or deficit-based ways of looking at presenting problems. And this is much of mainstream mental health, which is immersed in this sort of medicalizing or medical model of first diagnose a pathology and then fix it. We're going to contrast that with more strength-based approaches, which for most of you will probably be a new idea. What is a strength-based approach to therapy? That has much more to do with looking at, again, symptoms in context, so those pathological labels tend to fall away. And when you look at a symptom in context, again, it starts to make sense, and you start to understand the logic of the symptom. And oftentimes, you'll notice that symptoms serve a specific function. And so it's not this idea like it's a cancer, a therapeutic or a clinical symptom, and we have to cut it out, but rather let's look at it in context, and those labels and that those pathological ideas about the symptom tend to fall away. And what happens is interesting solutions tend to emerge, or interesting perspectives tend to emerge that free people up to view themselves and their relationships very differently. More to say on the distinction between deficit-based approaches to therapy and more strength-based approaches. A little bit more about me. I've been in private practice for about, as I said, 25 years. I've always alternated my time between teaching and practicing. For about the last 12 years, I've been involved in an intensive couples therapy project called Couples on the Brink. We do private couples retreats with the idea that most couples that go to therapy are really struggling and oftentimes in crisis and hanging on by a thread. Occasionally people come to therapy when there's a little bit of a problem in their marriage or long-term relationship, but most often couples come in some kind of a crisis. And so in recognizing that, we have put together a program that's much more intensive. It's a co-therapy format, and we bring a lot of the original pioneering spirit of family therapy to the work we do at Couples on the Brink. And if you're interested, you can read more at our website. In this class, again, we're going to be talking a lot about different approaches to marriage and family therapy, different theoretical ideas. Hopefully you will feel stretched in encountering some of these ideas for the first time. I encourage you to be patient with yourself. It takes a while to begin to think more systemically and get out of the individual pathology mindset. But I think this is going to be a really interesting and stimulating course for you. From here, just post that you were able to view the faculty welcome message and maybe one thing that it might have sparked in you. And also go to the faculty expectations tab and read the faculty expectations as well as the expectations for counseling program learners document that I posted as well. Here's to a great course, and I will see you in the first unit.